The Indigenous way of approaching healthcare is a lot to do with working with the mind, body, and spirit. When people come in and they're going through a difficulty, we will work with them verbally. We will work with them emotionally rather than introducing them to medicines and to all of those things. Because if the mind is not clear, if the mind is not accepting of what is taking place, then that's where the sickness comes from.
We find wellness in community. So it's that social coming together that is a resource for our people. And I think many Indigenous people across Mother Earth could relate to that ability to connect as human beings has a healing and wellness quality to it.
Our people on the streets are going through one kind of trauma or another, in some cases many traumas. And then you have the historical trauma. Physically, from a Western perspective, they're not sick. But from a spiritual and cultural perspective, they are very sick because of what they've had to come through, the trauma. And as a result, that's what we doctor with. That's where we begin our doctoring.
We have a colonized health system. It's time to take a look at addressing how we can make improvements, big improvements, for the Indigenous population who receives care.
The average woman that presents has been touched by that child welfare system. So when we're thinking about healthcare intervention, we have to look at an integrated model. Many of the women, the two-spirited ones, the girls that are accessing healthcare have been sexually traumatized. And these individuals then turn to drugs in order to try and assuage their pain. And these are the ones that end up accessing healthcare services. And we cannot deliver healthcare in a safe way without acknowledging that, and the supports that they may need in order to feel taken care of, in order to feel safe.
The Lois Hole Hospital for Women sees patients from all over central, northern Alberta, throughout Canada's northwest, across the prairies, and 30% of our patients identify as Indigenous.
To have that culturally informed way of delivering healthcare, my hope is that that would create more of a felt sense of safety for those that are accessing services there. Whatever that looks like, whether that looks like ceremony, whether that looks like someone there to hold their hand, someone to acknowledge their trauma.
We have a golden opportunity to work together, to move forward together and understand each other and the health conditions that take place within the Indigenous community and the non-Indigenous community. And how do we put those two together to help make healthier human beings and support them in their health?
First, we're going to hire 2 new clinical positions, an Indigenous health advisor and an Indigenous cultural liaison. Secondly, we know we don't have the answers. We know we have to reach out to our Indigenous partners and hear their stories on how we can help. We're going to repurpose our inpatient spaces, including in our labor and delivery, antepartum and postpartum units, and create an Indigenous mural to celebrate the life of Indigenous cultures.
The facts are there, the anecdotes are there, the news stories are there, and some of them are really, really difficult to hear. But you know, it gives us an opportunity to reflect and understand how we can do better, that we need to be doing better. And community investment into healthcare is what drives progress forward fastest. Thank you for considering the needs of this group of people who have been not served well by our health system, who have had barriers to access in our health system. Thank you for helping us improve. We are honored to be able to work with the community and with Indigenous groups who inform how care needs to be delivered in this program. The maternal and child health program here at the Lois Hole Hospital for Women will be changing because of this. And we're excited to say that the Lois Hole Hospital for Women is the first tertiary care hospital in Canada to be integrating these Indigenous care practices in this program. That's really something.